everyone. My name's Ayisha, and I'm here today to be talking about fertility. I'm here with Abha Maheshwari. Have I said that right?
Yes, you are absolutely right.
She is a consultant in reproductive medicine and honorary professor, also the director and person responsible at the Aberdeen Fertility Centre, so the expert about fertility to go to. Thank you so much for spending the time to talk to us here. Fertility is such an important topic, that we quite often we don't focus on. For example, according to data, the uptake of having IVF is lower in Black and Asian and other ethnic minority communities. And this has slowly been increasing over the last 5 years. And interestingly enough, in the Bangladeshi community, this uptake of IVF has actually increased over the past 5 years. So, women in generally, we're having careers, we're having babies later on. And things about, freezing eggs, I know that that's not something a lot of people have thought about. And we could potentially regret not doing that. And so I know that it's not on the radar of many South Asian women. But it's important that women, have or are empowered, and make these kind of informed decisions and choices and feel confident to access IVF. So I've got lots of questions that I've asked loads of people to think of. Hopefully we don't overwhelm you with loads of them. But firstly, please just tell us a little bit about the statistics around fertility in women.
So if we talk about fertility, is, we say that 1 in 6 couples face fertility problems during their lifetime. So it's not a rare thing. And as you obviously have mentioned, that it puts lots of psychological pressure on women as well as men and the relationship, because it is one kind of, if you say WHO does recognize this as a disease, although you think it's not, some people say it's a lifestyle issue only, but fertility is an important part of life. And I think it has the same kind of, it has a lot of stigma attached to it as well, especially for women, especially in certain parts of the world. So it has to be taken seriously, and at right time and in the right phase, it has to be investigated as well. So we can deal with the things that if there is a cause identified, sometimes we don't find any cause, but everybody should have a right to obviously have the information about it and have access to the care that everybody deserves without any sex, race, or ethnic variation.
Yeah, I mean, 1 in 6 is quite high actually. I was quite surprised to hear that. Okay, yeah. So 1 in 6. What kind of factors affect fertility then, if it's 1 in 6 couples?
Yeah, so 1 in 6 is when we're talking about couples who are having regular, unprotected, which means without using contraception, sex. But as you know, that there is we are in a bit of a changing society right now. And this is when heterosexual couple, one man has got sperm and woman has got eggs. That's what we're talking about. We have got same-sex couple, then we don't talk about duration of infertility. They are obviously needing some assistance with the fertility treatment. So the definition of fertility or infertility is completely changing right now. But if we stick to the traditional definition, which is 1 in 6 couple face subfertility, I would say, rather than infertility, because it's a reduction in fertility, or they haven't been managed to conceive themselves within 12 months of trying. So the NICE, which makes all the guidance for the United Kingdom, has suggested that couples should be referred after a year of trying in these cases.
Right, okay.
Or earlier if there are problems where you would find that people could be referred earlier, or which suggests that there might be a problem which requires earlier attention, would be a woman having irregular periods, because if you're having regular periods, you're producing egg regularly. If you're having irregular periods or no periods, then obviously egg production is maybe an issue. If they are older, especially after the age of 35 years. American Society does recommend that they should be referred after 6 months of trying because it takes longer to conceive and fertility does reduce significantly with age. If there have been a previous history of a long, say if somebody has taken chemotherapy or cancer drugs or long-term medication, that is another one. Previous history of chlamydia infection, that affects the tubes. Or if there is any identifying factors in terms of men, if they have had again previous chemotherapy or any previous surgery to testicles, or their testicles have to be fixed, then I would expect them to be referred earlier because if there's anything found, at least we are able to identify and treat the cause or at least give them explanation of what can be done.
Yeah, I think it's interesting. I mean, that's quite. I mean, again, like I'm saying, the 1 in 6 couples it's just stuck with me really. I mean, obviously there's a lot of factors there with when it comes, but the average you're saying is 12 months. If there's any issues after that, then go see the GP.
Yes, at least start the investigation and then you get referred to the fertility clinic. There is specialized fertility clinic attached to every single primary care or GP surgeries. And so every place will have their pathways of what GPs will do initial investigations, they get referred to the clinic and then clinic have their pathway to sort out. Yeah.
Okay, yeah. I mean, also another kind of issues that we have in the BAME community is kind of high risk of, well, we've got higher stats really of diabetes, hypertension. You know, do these things affect fertility as well?
So they don't directly affect, but yes, they affect in a way. And in the BAME population and Southeast Asian especially, we have got higher risk of polycystic ovarian syndrome.
Right.
Which
Yeah.
then they cause irregular periods and problem with the egg production every month. So they are definitely, in that category. The polycystic ovarian syndrome itself is associated with high risk of diabetes and hypertension. And if you've already got that pre-existing, then that puts you at a high risk of getting to pregnancy and pregnancy complications.
Right, yeah.
Uncontrolled diabetes does lead to increased risk of miscarriages as well, because ultimately fertility, you don't just want positive pregnancy test, you want a baby and a healthy baby in hand.
Yeah, that's very true. And think, you know, you always just think, get pregnant, get the result on that stick, rather than actually having a successful kind of healthy pregnancy, you know, overall. Okay, what about smoking? Does smoking affect?
Absolutely, you're absolutely right. Smoking and the weight are the lifestyle issues that you can do something about and have definitely affect fertility. There were some studies previously shown that what smoking does to you is both men and women get affected. So both sperm and egg. So there are studies to show that if you're smoking, then your eggs get affected, and if you know that there is limited supply of eggs that a girl is being born with, and all it can go is downhill from there rather than uphill. They're not formed any new. So your maximum number of eggs are when you are born, or actually 5 months into the pregnancy when you were in your mother's womb.
Wow.
After that, it goes downhill. So at delivery, they're already down, and then they keep going down and down and down. So smoking increases the age of the ovary, which means smoking, if I'd be very kind of simplistic way, smoking kills the eggs, and those eggs are not formed again. So if you have smoked even in life before, then your egg count is likely to be lower, or the quality of eggs may be affected. Okay. So that is one thing that you can do for yourself, even when you are young, to not compromise your fertility later. In terms of sperm, smoking does affect sperm as well. Sperm does get made again, so there is a possibility that it can be, because it takes 90-day cycle, whereas egg doesn't have that opportunity. In terms of smoking also, if somebody needs, say, fertility treatments, for example, IVF, which is test tube baby, if one partner is smoker, then the chances get reduced. If both partners are smoking, then their chances are further reduced. So to optimize your own chances, you obviously have to stop smoking. And most of the places, smoking comes in the NHS funding criteria for that reason, along with impact on pregnancy, health of the baby when the baby is in the mother's womb. There is also interesting data some places that shows that smoking affect obviously not alone your fertility, but if a girl is or a boy is in your womb, their fertility, because smoking obviously is going to affect, and then their gonads are developing there. So, you know, it has a transgenerational effect, not alone effect on you.
Wow.
Smoking is something we really need to kind of work on.
So that could affect your children as well. That is crazy.
Yeah, I mean, obviously data are limited, but obviously that there's more data coming on that side.
Yeah.
In terms of, yeah, exactly, the weight is another thing that affects the fertility. Number of times I tell my patients, you have to lose weight, which is very hard thing to say. I mean, they've already got stress of fertility. Stress causes increase in the weight because most of the time, because of stress, you eat more, you know. And it is just a vicious circle. We all know that, but we all love our food, you know.
Yeah. Oh, definitely, yes. Especially stress eating.
Yeah, no, I'm equally guilty about that. But weight affects fertility. There is evidence that your chances of getting pregnant on your own are decreased. When you get pregnant, your chances of miscarriages are higher if you're overweight or obese. And your chances of conceiving with any fertility treatment are reduced as well, and you require high dose of medication, plus complications in pregnancies are increased, and all with this COVID that you've heard with high overweight and obesity, that puts you at further other things as well. So yeah, weight and smoking is something we can work on, along with age. Obviously, age is something you can't revert back, and same as smoking, you can't revert back the effect of weight.
Yeah. Yeah, but we can help ourselves in terms of trying to stop if we are at the moment, you know, and improving our chances that we have. So it's interesting that you're saying about the, you know, the sperm and the kind of low, you know, the less sperm or whatever being produced as a result of smoking. So it's not, you know, it's quite often in our kind of, you know, especially in the kind of South Asian community where we tend to focus on the woman. You know, where is she going wrong? She can't have the baby. It's never about the man. So actually, this is great. This is great information because we can actually tell people, well, actually, you know, maybe the dad needs to do something. The potential dad needs to do something as well by helping, you know, stopping smoking or things like that as well, rather than just focusing on the woman solely.
No, it's not women alone. It is a couple disease. I mean, that is where it differentiates from other diseases. And if we talk about disease or other conditions in healthcare, is that you're talking about two people
Yes.
having treatment jointly and both effects. And I know you're absolutely right. Most of the emphasis is on women most of the time, and most of the stigma in some parts of the world is on women, but it is both.
Yes.
And sperm has equal role to play.
Yes, exactly. And this is why it's great to have a conversation with an expert like you about this to address these kind of issues that are actually happening. And you know, and you mentioned obviously age as well. I mean, it's funny that, you know, we've all heard the kind of comments. I mean, I've just turned 30, which and I've got one child. She's 17 months old, and I keep getting the odd comment here and there from someone saying, "Oh, you know, you need to quickly get them out of the way because you're getting a little bit older now." And you know, you have addressed that. You've said actually age, is it over? Did you say over the age of 35? You know, chances of use or
Yeah, I mean, as I said, the eggs always decline. Yeah.
yeah,
So the ideal age, if you talk about the ideal, is probably somewhere between 20 and 30. However, every year after 30 age, the fertility declines, but after 35, it is a dramatic decline. But bearing in mind, so the reason it declines is because your eggs get older.
okay,
Now, eggs not always behave same to your chronological age because there is variation. As you know, some 40-year-old conceive without any problem, whereas 30-year-old are struggling. So your age of your ovaries is different from your own age.
Okay. Yeah.
Most of the time, your age is kind of, it gives you a idea, and that is probably the most important factor. And on rough guide, as I say, 35 is where we say, you know, there is a dramatic decline, and after age, definitely.
And what is the kind of percentage of kind of likely getting pregnant after the age of 35? So, you know, maybe a 40-year-old.
Yeah, if I give you rough figures from IVF, because that's where we have got the data. We haven't got the data for people getting, because we don't know who's using contraception, who's preventing pregnancy, who's having sex. But from IVF, if you think that we say at the age of 35, you got, or under the age of 35, you've got almost 40% chance, between 40-45% chance to getting pregnancy or having a baby in hand.
With IVF. Okay, yeah.
Between 35, 37, we say about 35. Then between 37 up to 40, about 30% chance of success. At the age of 40, we suddenly say 10 to 12%.
Wow, okay.
At the age of 45, we say less than 1%.
Wow.
So 35 and above, it is obviously a bit difficult. So 25-30% there, and then suddenly 10 to 12%, then you're talking about less than 1%. So that is very, very steep decline there.
Yeah, I mean, because sorry to cut you on, I know you were about to say something, but obviously that's quite, I mean, it's quite a big figure that. Obviously age, you know, from your kind of statistics, you're saying that age obviously does affect fertility. So do you think it's a good idea then for women at a younger age to freeze their eggs?
No, is the short. Yes, more
Oh.
fertile at that time. So freezing eggs, and I know there is a big industry about freezing eggs, and there are some cartoons as well, which even I have shown in my some of my talks I've given, that parents giving egg freezing voucher as a graduation present to girls.
Oh my gosh, what?
But you know that egg freezing, what it does is, obviously you can get your eggs frozen. You have to go through almost IVF. You have to get through injections. You have to go through the surgical procedure. Now you don't know at the age of 20 when are you going to whether you'll need them or not, because remember I said 1 in 6 women have trouble conceiving, but rest of the people are conceiving themselves. So why to go through all that procedure? And there are risks associated, risk of ovarian hyperstimulation, there is a risk of surgery. And when you don't know whether you'll be needing them or not. And IVF is obviously invasive, not alone invasive, it's psychologically wrenching, as well it's a very expensive procedure.
Right.
I think what we need is education to women about lifestyle factors, about obviously medication, about the chlamydia, because that affects the tubes, you know. So what we need to do is educate women, empower them, and let them make the decision as to what they want to do. I don't think freezing eggs for every young girl is the answer. Absolutely not, because that is unnecessarily medicalizing it. And what we also forget that there are more risks of the babies born for after IVF compared to those born after conceiving on their own.
Right. Okay. Okay.
So although the proportion of babies born by IVF is 2-3% currently in UK, so that increased risk in absolute number is not more. Is not kind of significantly more. However, if everybody is having freezing eggs, everybody is having IVF, and that's going to be not just a burden on NHS, but for yourself as well. If you have obviously all those risks associated with yourself,